The nurses of Desert View Hospital just completed a pediatric training program. We spoke to the director of nursing.
6 of our nurses just completed the emergency nurse pediatric course, which is a 2-day class that gave us a 4-year certification for caring and increasing our knowledge to care for pediatric patients.
Pediatric medicine differs from standard adult medical practices.
They are not able to adapt to changes as easily as adults do. Their bodies are more fragile. Their heads are heavier. They don't have developed neck muscles, so they can be injured more easily than adults can. And plus, they're subject to abuse. So that's another thing that the course kind of focused on, and learning how to communicate with the pediatric patient, because obviously you can't communicate with them the way you do an adult.
Desert View Hospital has made some improvements overall with more training and hiring more nurses.
I have a nurse that in her other job, she's had extensive pediatric training and transport training and neonatal training, so that's really exciting. We recently hired a nurse that had previously taken the EMPC course, so right now more than half of our full-time staff have this EMPC certification.
These changes at the hospital are expected to aid with the initial emergency care of patients.
Patients will still have to be transported because we don't actually have the pediatric inpatient unit, but the initial emergency care, I think we'll be able to provide a more thorough assessment. We'll be able to intervene earlier. We'll know what signs, and there's subtle changes with pediatric patients that we want to watch for, and we'll be able to identify those.
There is more training scheduled in the future.
We are doing some stroke and cardiac training, and then I'm hoping that my nurses will finish up doing that CEN, the Certified Emergency Nursing test, and get that certification pretty soon.
I'm Jennifer Moots, reporting for News 46.